What is ECG Electrocardiography? Welcome back to my channel, guys. Today we will discuss about what is ECG. आज इस चैनल पे हम ECG की जानकारी लेंगे। इसमें आपको पूरी तरह से ECG समझाएंगे। न्यू गाइड है ये। बेसिक ECG क्या है, कितने लीड होते हैं, कितने तरह के उसके वेव होते हैं और पूरा इलेक्ट्रिक कार्डियोग्राम एक्टिविटीज़ हार्ट के अंदर कैसे होते हैं, सब इसकी जानकारी लेंगे। तो चलिए दोस्तों शुरू करते हैं। सो व्हाट इज ईसीजी? ईसीजी इज electrocardiography is transthoracic interpretation of the electrical activity of heart over time captured and externally recorded by skin electrodes for diagnostic or research purposes on human hearts. In 1903, William Enderman, a Dutch doctor, Dutch means German, a Dutch doctor, physiologist, he invented the first practical electrocardiogram and received Nobel Prize in Medicine in 1924 for it. Now modern ECG machine look like this, and the first one you can see ECG machine. Electrocardiogram usually called as ECG or EKG. Standard calibration speed is 25 mm per second. Amplitude is 0.0 micron. Volume per millimeter. So, how the patient is placement? How to do electrocardiography? Place the patient in supine or semi-floor position. If the patient cannot tolerate the being flat, you can do ECG is more upright position. Second, instruct the patient to place their arms down by their sides and do relax their shoulder. You can see if the instruct the patient place their arms down towards the leg and relax the shoulders. Make sure the patient legs are uncrossed. Make sure the patient legs are uncrossed. Remove any electrical devices such as cell phones away from patient as they may interfere with the machine. If you are getting artifact in the limb, please try having the patient sit on the top of their hands. ECG artifacts. So, cause artifact patient movement, lose the defective electrode and improper grounding. Electrodes usually consist of the conducting gel embedded in the middle of the self-adhesive pad on which cable clips. 10 electrodes are used for a 12-lead ECG. Okay, RA. Right arm avoiding muscle. Okay. LA on left arm this time. RL means right leg, L means left leg. The 6 chest electrode V1 fourth intercostal means fourth intercostal of right sternal body. Okay. V2 is fourth intercostal space same as right one. Fourth intercostal space left sternal body. This V1 on right sternal body and V2 is on left sternal body. V3 midway of V2 and V4. Midway of V2 and V4. Okay. V4 is fifth intercostal space mid clavicular line. This one mid clavicular line. Clavicular mid clavicular line V4. V5 left lever of V4 left anterior axillary line. Okay. And V6 level of V4 left mid axillary line. Okay. How does an ECG work? ECG work mostly by detecting and amplifying the tiny electrical changes on the skin that are caused when the heart muscle depolarizes during each heartbeat. The patient lying supine wearing serum. These are electrodes. Place all electrodes correctly. People usually refer the electrode cable as leads. Okay, that's confusing. Leads should be correctly defined as tracing of the voltage difference between the electrodes and what is actually produced by ECG recorder. So where are the leads? Okay. Right arm, left arm, right leg, left leg. Okay. They are formed by voltage tracing between the limbs electrodes RL and LL. These are only bipolar leads. Altogether, they are called limbs leads or internal triangles. Leads AVR, AVL, AVL. They are also derived from limbs electrode. They are RA. ठीक है RA, AVL, AVL, okay, AVL. Measure the electrode potential on point with the respective non-augmented leads. Leads V1, V2, V3, V4, V5, V6. They are placed directly on the chest because of their close proximity of the heart. They do not require augmentation. They are called the pericardial leads. A normal ECG wave are remember PQRS complex ST segment T wave. The normal size PR interval is 3 to 5 small squares. PR segment, PR interval. PR is complex, 3 is smaller, 2 is small, 2 larger. Obtain ECG and confident treat the PT details. Example of computer ECG. The best way to interpret ECG do step by step rate, rhythm, cardiac axis, PR interval, QRS complex, ST segment, PT interval, order ECG signs. Rate. Calculating the rate small. Rhythm. Rhythm. Look at keywords. There are relationships to QRS complex lead second commonly used. Regular or reload. If in doubt, use paper stick to map outcomes with bits and see whether rate is same further along with the ECG. Normal sinus rhythm. ECG rhythm characterized by usual rate of anywhere between 60 to 99 per beat, beat per minute. Every P wave must be followed by QRS and every QRS is preceded by P wave. Normal duration of PR interval is 3 to 5 small squares. The P wave is upright in relation first and second. Sinus bradycardia rate is 60 beat per minute, otherwise normal. Sinus tachycardia rate is 100 by otherwise normal. The rhythm is same, but the rate is high, so sinus tachycardia. Sinus pause. In this is sick sinus syndrome, the SNR can fail in its pacing function if the brief recovery is from the result only a missed beat. If recovery is delayed and no other focus assumes placing function. Atrial fibrillation of it is most common cardiac arrhythmia involving the atria. Atrial flutter, ventricular fibrillation, a severe abnormal heart rhythm that can be life-threatening emergency require basic life support BLS. Rate cannot be discerned and rhythm unorganized. Ventricular tachycardia, fast heart rate that originates in one of the ventricle, potentially life-threatening arrhythmia because it may lead ventricular fibrillation, assistole, and sudden death.